Good afternoon, learned colleagues. Today I'm recording another video on knowledge for you. Uh, this is another very interesting and challenging patient which we did in our clinic. This is a 42-year-old female who came to us with chief complaints of severe dysmenorrhea, heavy and prolonged menstrual bleeding with big dark clots. The accompanying symptoms were chronic pelvic pressure and pain in the right lumbosacral area, which was radiating to the right hip, right inguinal region, and low-grade fever, fatigue, loss of appetite, severe nausea, and all these symptoms were getting aggravated during the menstrual cycle. She also had a past history of PCOD. Emotionally, we found her to be very anxious, stressful, and full of frustration. The investigations which were done were a pelvic ultrasound which showed severe adenomyosis, and her gynaecologist had advised her hysterectomy. But since she was an old patient of ours who used to come to us for various other problems, so she came to us seeking advice for the treatment for this condition. Now, according to Western medicine, we all know adenomyosis is a benign uterine condition where the endometrium actually breaks through and grows into the myometrium of the uterus, and which causes internally heavy bleeding, severe cramps, particularly during the menstrual cycles. And according to the acupuncture theory, this is a condition in which there is blood stasis in the pelvis, which prevents the smooth flow of blood and triggers all the symptoms of adenomyosis. Now, what is the core root cause according to acupuncture? In her case, it was a liver qi stagnation which was caused due to anxiety, stress, frustration. Now, this stagnant qi is not able to push the blood smoothly, and hence the stasis happens. Coming to the treatment with acupuncture, what did we use? We used the points UB32, which releases the pelvic congestion, extra point Shizuku for menstrual pain relief. This is a point located in the midline below L5. I will be definitely sharing the location also of this point. The other points which I am talking about are all classical acupuncture points. I don't need to share the locations, but this is a point which is an extra point, so I will share the location. The next point is Zigong. This is again an extra point which reduces pelvic congestion, and this point is located 3 chun lateral to REN 3. REN 4 and REN 6 you all know very well. It smoothens the movement of the blood in the uterus. The other points which we used on the legs were the points spleen 8 and spleen 6. Both these points regulate the blood flow and stop the acute pain. The point stomach 36 which strengthens the chi. The point kidney 3 which nourishes the reproductive system, and the point liver 3, very important because this point soothes the liver qi stagnation. The course of treatment was given, the total treatment was given over a period of 2 months, initially thrice a week for 2 weeks, then twice a week for 2 weeks, and then once a week for 2 weeks, and then followed up fortnightly for 2 weeks. So what was the effect of the acupuncture treatment? And that is the best part of the whole story, is that all her symptoms of severe dysmenorrhea, heavy bleeding, big clots, right hip and right inguinal pain, and fatigue have totally settled down, and she is totally recovered from her problem. The best part, which I am now going to share with you, is the pelvic ultrasound, which was repeated after 8 months, and it showed smoothing of the myometrium ecotexture. There was no trace of PCOD now, which was there initially in the earlier ultrasounds and in the pelvic ultrasound also. And even the radiologist was quite surprised, and she said to the patient that this is the first time in my life that I am seeing that with the previous ultrasound as compared to this, the entire adenomyosis is cleared up, and there is much improvement as compared to the last ultrasound. I am quite confident that with this knowledge you can also treat similar patients which come to your practice and get great results with acupuncture. Thank you for your patient hearing. I will just, after this, I will be just sharing with you the exact locations of the 2 extra points which I used in my protocol. Thanks. So this is the point Shizuku. This is an extra point which is located in the midline, in the mid spine, below L5. And this is the point Zigong. So first we locate the point Ren 3, and from there 3 chun lateral to Ren 3 on either side is the point Zigong. And I will strongly recommend that this protocol should only be used by the medical doctors who are practicing acupuncture. Thank you very much.